Hi everyone, my name is Gal Board. I'm a pharmacy student at Shoppers at Upper Canada Mall, and I'm here on behalf of South Lake Cardiovascular Prevention and Rehab Center to give you a short talk about a review of your cardio medications. Um, so for today's talk, I wanted to cover just some general medication tips, the goals of the medications that you may see or may be taking. I want to delve a little bit deeper into each medication class so you get a better understanding of how they work. I want to shortly talk about herbals and alternative medications that you may see or may be taking. Um, and while I can't answer your questions today, you can feel free to talk to any healthcare professional or email the rehab center, and I'm sure they'll be glad to help you out. Um, so to begin, just some general medication tips. Getting your medications from one pharmacy can help all of your healthcare professionals get a better understanding of the medications you take. It also helps the pharmacists ensure that the medications you're taking are safe. For example, if you're getting two different medications at two different pharmacies, each pharmacist might not know that you're taking these medications, and what if they interact? So even if it is convenient for you to go to multiple pharmacies, it may be a good idea to just bring a list of your medications to each of them so that they know what medications you're on. As well, it is important to have a good medication list so that when you do speak to any healthcare professional, they have a good understanding of what you're on. Compliance means taking your medication the right way, the right time, the right frequency. So taking the medication the way it was prescribed is always very important. It ensures that the medication is safe and effective. It can be very overwhelming to take all your medications at the same time the right way. If you do find that this is a challenge, you can get the pill organizers that you see on the screen. You can talk to a pharmacist to get a blister pack made for you, which is like an organizational binder with your medications in it, so you just pop them out at the time you have to take them, or setting reminders on your phone or anything to remind you to take your medication on time. Sometimes you do miss a dose of your medication. It happens to everyone. It's completely normal. But each medication is different, so it's important to know what to do when this happens to you. Some medications you might just have to take the dose as soon as you remember. Sometimes you skip it. Sometimes you take two the next day. This all depends on what medication you're on. So when you do get any new medication, it's a good question to ask your pharmacist, what do I do if I miss a dose? And they'd be glad to tell you. Storage and disposal. So storing your medication the right way to ensure that it's still effective is very important. A lot of people keep their medications in their cupboard in their washroom, which gets humid and hot, and that might not be the ideal place to store them. For the most part, most of the medications that I'll be talking about today are stored at room temperature in a dry and cool area, but that could be different for any medication, so it's important to know how to store it. Many medications also expire as soon as you open them, well, a month after you open them rather, or if they're not taken correctly, they might end up expiring. So it's important that if you do have any extra medications, to know the expiry date on them, and if they are expired, to dispose of them properly. One way to do that is to bring them to your local pharmacy and they can dispose of it for you. So a few more tips. Many medications, as you know, do interact with alcohol, so it is important to be aware of that as well. That doesn't necessarily mean to cut out alcohol completely, but it may mean that you might have to take a medication in the morning if you plan to have wine with dinner or something like that. So it's just important to let any medical professional know if you do consume any alcohol, just so that they can better counsel you on your medication. I know traveling right now isn't the easiest, but if you do or are planning to go away, it's important to have enough medication with you, obviously. So when you do speak to your pharmacist, you can let them know that you're going away, and they can give you up to a 3-month supply of your medication, or up to a 6-month supply of your medication, actually, to ensure that you have enough while you're away. Yeah. When you visit your doctor or any other healthcare professionals, it's important to know what medications you're on, so that they can prescribe you the right thing. After you have any cardiovascular issue, it's important to continue to follow up with your doctor, because many of these medications, their dosage changes according to your lab work, to how you're feeling, to your blood pressure, etc. So it's important to continuously follow up so that your prescriber can change the dose and adjust it to better suit your goals of therapy. And again, if you do need a medication list, just go to your local pharmacy and they can print one for you. It's good to keep on hand, and it can get you treatment a little bit faster and safer. So you've had an issue with your cardiovascular system and you got prescribed medication. What's the point? So these heart medications, they all work a little bit differently, but ultimately their goal is to protect your heart and to stop any more issues from occurring. Just some of the different ways they can work. They can lower the workload of your heart. So it's still beating, it's flowing your blood accordingly, but it might not have to work as hard to do so. It can protect the heart, so it would reduce any risk of clotting or improper blood flow or irregular heartbeats. It can improve blood flow. It lowers and controls your blood pressure so that you don't have any super high spikes or maybe even very low blood pressure as well. And many medications also prevent blood clots. So our ultimate goal here is that you're using your medication safely. These medications are ultimately here to improve your health, but they still must be taken correctly at the right time, the right route, the right dose, everything, to ensure that they're effective. And that's not only on you, it's also on your healthcare professionals. They should be educating you, picking the right medication which suits your needs. Everyone's a little bit different, everyone's system works differently, so it's important to continue and hold these conversations with your healthcare professionals to get the right medication for yourself. So the first drug I'd like to talk to you about are blood thinners. So the most common one is ASA, commonly known as aspirin. That's the brand name. This medication is an antiplatelet drug, so it stops the platelets in your blood from coagulating and clotting, which can cause a blockage and can cause a stroke or a heart attack. Regularly, these are prescribed. If they weren't prescribed to you, that's completely normal. That's up to your doctor's discretion. So you don't necessarily have to start taking them just because you've seen them. They can upset the stomach, so it is better to take them with some food. Many of them are enteric coated to protect the stomach a little bit more. And because it is a blood thinner, it's important to know what over-the-counter medications you might be taking. For example, if you're taking Advil, it can interact. And because you do get this medication over the counter, many times it might not pop up at the pharmacy or in the hospital or at your doctor's office. So it's always important to remind the healthcare professional you're talking to that you are on aspirin. So clopidogrel is another antiplatelet medication. It's a little bit newer. It's very easy to take. Usually it's just prescribed 1 tablet once per day. It many times is combined with aspirin, or you're to take it with aspirin. And It's very similar to aspirin. It works by stopping coagulation of platelets and prevents blood clots. It can cause an upset stomach, heartburn, and rarely a rash can form. But if that does happen, speak to your healthcare provider and hopefully they can provide you with another medication. Ticagrelor is an even newer antiplatelet medication. It works the same way. You may have been prescribed it. It is very effective. One important thing is to recognize if you're having any trouble breathing. That's a very serious side effect, and it's important to go to the hospital and contact your doctor if that does happen. It many times isn't covered by the government, and it can tend to be fairly expensive. So if that's a problem, a doctor can find you an alternative. Now on to blood thinners. These work a little bit different. They don't necessarily stop the platelets from coagulating. The most common one is warfarin. It's an older medication and it is still fairly commonly seen. It's usually given once daily, and the dosage for this medication is very important. You do want to be at a very specific level for this medication. So if you are on this medication, your doctor may have asked you to routinely do some blood work, and it's very important to continue doing this. One main problem with warfarin is that it interacts with many medications. So whenever you take a new medication, even if it's over the counter, even if it's an herbal medication, it is important to quickly even ask the pharmacist to make sure it doesn't interact. And it also, so the way warfarin works, it inhibits the vitamin K in your blood. And so your diet can also play a role in how this medication works in your body. So if you are having or planning to change your diet significantly, this might be another important conversation to have, just to ensure that the medication is working correctly. The main side effects, they're usually just an increase of chance of bleeding. So that could be externally or internally. So it's very important to learn how to watch and recognize these side effects. But I'll talk a little bit more about that later. And now these are the newer blood thinners. These you might see or even have been prescribed are in place of warfarin. So these are usually also taken once a day, and one of the main benefits of these medications is that they're usually less, the dose is less tighter than warfarin. You have to do way less blood work, and it works very similarly, if not better than warfarin. So the main benefit is the safety. The main issue, though, is compared to warfarin, any overdose effects are harder to reverse. So it's very important that you are taking the medication correctly. If you do have any kidney problems as well, this may not be the right medication. Warfarin might be prescribed instead. And yeah. So blood thinners, they thin your blood. So it's really important to recognize any bleeding issues, and it's important to regularly monitor your blood. It's important to let anyone know that you are on these medications. It's important to understand how they work. So recognizing any bleeding that occurs, which shouldn't happen, for example, any unexplained bruising or easier bruising that doesn't go away soon as it should, any blood in the feces, any I don't know, like if you do get a cut and it won't stop bleeding right away, this is important to know and to speak to your doctor about, just to ensure that these medications, are harming you in any way. So just to ensure that, recognizing it, doing blood work, many, as I said, using stomach protectors can help, especially when you are taking medications such as aspirin. Even taking it with some food can help. Yeah. So on to the next class of medications. These are ACE inhibitors. These medications that you see on screen are very commonly prescribed, and they're used to lower your blood pressure. They work by relaxing your blood vessels and increasing the blood supply to your heart. They're also used to protect the heart and the kidneys, especially for diabetic patients, and to ensure that your heart is still pumping enough blood throughout your system. They can reduce your salt and water retention as well, which is very important, and is another thing that can lower your blood pressure, rather. So these are fairly effective. They can reduce your systolic blood pressure by up to 8 points. While these medications are very effective and commonly prescribed, they do have a few noted side effects. Commonly, they do increase your levels of potassium. So especially when you just start the medication, your doctor might ask you to get some blood work done to ensure that your potassium levels aren't too high. They can cause a rash. They may cause some dizziness or lightheadedness. And one of their most noted side effects is a dry cough, and it can be very bothersome. It's usually unexplained, and it's caused by the way this medication works. If this does happen, it's not the biggest issue. There's another class of medications called angiotensin receptor blockers, or ARBs. They work in a very, very similar way to these medications, and they tend not to cause a dry cough. They still might, but it has a much lower chance, so it's a great drug to consider. So on to beta blockers. These are also used to decrease blood pressure. You might have seen these medications. They are very common as well. Another benefit of beta blockers is that they also tend to correct any irregular heartbeats, so any arrhythmias. So if your doctors have noticed these arrhythmias, you will probably get prescribed a beta blocker to ensure that it happens less frequently or is more controlled. They're also used for angina patients as well, and they work by decreasing the workload of the heart. Beta blockers do have many notable side effects, such as lightheadedness, tiredness, colder hands and feet, worsening asthma. If you are a diabetic patient and want to better control your blood sugar, these beta blockers do tend to increase blood sugar, and they can even mask symptoms of low blood sugar, which can be very dangerous. So if you are a diabetic patient, it is important to understand the side effects of this medication. So on to cholesterol-lowering medications. The most commonly prescribed medications are statins. You can see some examples on the screen. They lower your LDL, which is your bad cholesterol, and they can slightly, but still effectively, increase your HDL, which is your good cholesterol. They work by lessening the cholesterol production in your liver, and reducing and controlling your cholesterol is very important because it slows the narrowing of your arteries, which can prevent any blockage, which again can lead to heart attacks, strokes, etc. And so after any heart conditions, most of the time you will be prescribed a statin. Other medications include ezetimibe. which is rarely used on its own, but it works in your intestines to reduce the cholesterol absorption from the food that you take. And while it's usually not given by itself, it can be combined with statins to get a tighter control on your cholesterol. Fibrates are a newer medication, and it's rarely used, but if you do have diabetes and high cholesterol, it can be used to greatly increase your HDL to get a tighter control of your cholesterol. Because statins are so commonly used, it's important to learn about the side effects. One of the main side effects are muscle aches and pains, and these are unexplained. So if you worked out or worked all day yesterday and then you wake up and you're feeling sore, that's an explained side effect. Or muscle pain rather. But if you, I don't know, sat around all day or didn't get up too much, didn't work out, didn't do much activity, and then you wake up and then you're sore, that's unexplained, and that can be bothersome. So it's very important, if that does happen, to speak to your pharmacist or doctor about it. A very rare side effect is muscle weakness. This is a little bit different from the aches and pains, and this one is a little more important. If you are noticing that you are on this medication long term and you are getting muscle weakness, you wake up in the morning and something just doesn't feel right, it is important to speak to your pharmacist and doctor about that one. And then just some common side effects would be nausea or heartburn and stomach upset. So these are the more niche cholesterol lowering agents. So PCSK9 inhibitors, these are pretty new in the drug world. They're given by injection, and they're very effective for lowering cholesterol. But these are usually reserved for very high-risk patients, and they're usually more on the expensive end, so not always necessary, but they are effective. Resins, they're how do I say it? They're combined with statins usually, rather than used alone. They are pretty rarely used, usually if other medications are ruled out. For example, if you are getting some muscle pain or just some medications are contraindicated, resins can be used, but they can interact with many other medications and stop their absorption. So it is very important to be aware of how they may react with your medications. Psyllium, it can be found over the counter. It's just a basic fiber. You may know it as Metamucil, and while it is mainly used for digestive health, it's very effective in reducing your bad cholesterol, your LDL, because it's not properly digested. It can soak up the LDL from food, and it can reduce it by up to 7%. So this can be a good medication to add on if you do need a better control of your cholesterol. And now these are some other medications that you may have been prescribed or have seen. These are a little more niche and rarely used, but they are still very important and can be very effective. So to start off with diuretics, these are your water pills, such as hydrochlorothiazide or furosemide. They work by increasing your urine output, which decreases the water in your body, obviously, and reduces your sodium levels. And this has a very strong effect on lowering your blood pressure. And if you are prone to any swelling or edema, this is used for that as well. One of the main drawbacks is that it can decrease your potassium levels. So you may be asked to monitor your blood work as well. Spironolactone is another water pill, but it's special in that it's potassium sparing. So it has a very similar effect to the previous diuretics that I mentioned, but it doesn't decrease your potassium levels. Calcium channel blockers, they work by relaxing the heart muscles and blood vessels, so they increase the supply of blood and oxygen that gets pumped to your heart, and they reduce the workload. These medications aren't as common as some of the other blood pressure medications we talked about, such as beta blockers or ACE inhibitors, but they're still effective and can be used. You might see them around. So amiodarone and digoxin are two common medications that are used for irregular heartbeats. They are also used for chronic heart failure as well, and they can improve the strength and efficiency of your heart, and they have a better control of the rhythm that your heart pumps at to ensure that it's not wonky and that it's constant. And then we have your alpha-1 blockers. These medications are used mainly for BPH, so benign prostate hyperplasia, but they can also have a positive effect on high blood pressure as well. So if you are suffering from both, this may be a good medication. It's like two birds with one stone. And then on to nitroglycerin. So this medication is special. It's only used for angina patients. So if your doctors are worried that you may be suffering from angina, they may prescribe you nitroglycerin. It comes in many different forms. It can be a spray, as you see on the screen. It can come in a sublingual tablet that you put under your tongue. It can come in a patch or an oral tablet. It works by relaxing your blood vessels and increasing blood flow and oxygen supply to the heart. And it's, rather than be used daily, it's used only in emergency cases when you are having an angina attack. So some side effects are headache, flushing, dizziness, lightheadedness, because these medications are very effective and they can drop your blood pressure fairly quickly to stop an angina attack. So many side effects are very common with this medication, but because they're used on an as-needed basis, you're not going to see them as much. If you are on a medication such as Viagra or Cialis, this medication works in a similar fashion, so it is important to speak to a pharmacist or a doctor and warn them about this medication so that they can discuss what you can do, because they do interact and they should never be used together. So it is important to learn how to use the nitroglycerin spray because it is used for emergencies. So first of all, you need to learn how to recognize that you are having an angina attack. So that could be chest pain or discomfort, left side numbness or weakness, headache. Everyone's different, but hopefully you learn how to recognize these attacks so that you can stop them. So let's say you're having one of these attacks, you recognize it, it's important to stop and sit. These attacks do commonly happen if you are doing a vigorous activity. So it's important to, slow the heart rate, sit, relax, and you want to pump. You want to prime your spray, so you just want to pump it until spray does come out of the can, and you want to put one spray under your tongue. You want to wait for 5 minutes, and if there is some relief, that's good, you're great, you can go on about your day. If it doesn't help after 5 minutes, you want to do the same thing. You want to put another spray right under your tongue, and you want to call 911. Hopefully this medication works, but just in case, it is important to have 911 there to ensure that your condition doesn't worsen. If there is no relief and you're still waiting for 911, after 5 more minutes, you can do a third spray. So it is important to carry this medication with you at all times if it is prescribed to you. And it's important because this is used when needed. This medication may expire if you don't need to use it a lot, so it's important to watch for the expiry date. Um, and many patients do suffer from diabetes, so it's important to have a good base of information about diabetes medications. There are many. I'll try to go over them quickly, but they are very important to know. So to start off with, metformin, it's one of the most commonly prescribed medications for type 2 diabetes. It's very effective at reducing your blood sugars or controlling your blood sugars. And it actually has a very prominent effect on reducing your weight loss, which are one of the biggest risk factors for diabetes. And so this is a very effective medication. There's not too much to say about it. Sulfonylureas, like glyburide, glycoside, they increase your insulin secretion, so they are effective, but sometimes they're too effective. Sometimes they can drop your blood pressure, or not blood pressure, your blood sugar too much, which is called hypoglycemia, and that's also not where you want to be. So this is a medication that if you are prescribed, you should monitor for the first few weeks just to make sure that it's working correctly and that your blood sugar isn't dropping too low. So with any diabetes medications, once you're prescribed it, it is important to test your blood sugars pretty frequently, especially if it's a new medication. The DPP-4 inhibitors and GLP-1 agonists work in very similar fashions. The main difference is how they're taken. So one is taken orally, one is injected subcutaneously. These are newer medications and are much safer in terms of hypoglycemia. So they rarely do cause a significant drop in blood sugar where it can be dangerous. As with most of these medications, they might be added on to your metformin regimen, so they add on to provide an extra effect on lowering your blood sugars and controlling it. SGLT2 inhibitors are very commonly prescribed. They work by increasing the blood sugar that's concentrated in your urine, so you discard more, which can lower your blood sugar. It is commonly used in combination with metformin. Sometimes it even comes with one pill, which has metformin and the SGLT2 inhibitor, which is very convenient. One thing to watch out for, it can increase the chances of a urinary tract infection, so it's important to keep in mind. What else do we have? We have insulin. So insulin is at the heart of diabetes treatment. If you have type 1 diabetes, you've been on insulin all your life, you know how it works. Sometimes if your blood sugars aren't as well controlled and you have type 2 diabetes, insulin may be prescribed. It's very important to understand how to use it, when to use it, what effect it has on your blood sugar, and if you are on insulin, you will most likely also be testing your blood sugar. So it's important to know when to test it, what each number means, and to set a blood sugar target with your healthcare professionals to know what levels your sugar should be at. Speaking to a pharmacist or even to your doctors, they'll show you how to inject the insulin and how to ensure that it's safe. You may have to go for many follow-ups and to get the dosage to your effective level. So the dosage can change from person to person, and even after a month, let's say you lose a lot of weight, you're in much healthier shape, you're feeling better, you might be taken off insulin, or the dosage might decrease, which is always a good thing. So other ways to improve your heart health: you've been given your medication, I know you're going to be taking it correctly and safely and it will be effective, but what else can you do? So your diet plays a huge role in your cardiovascular health. consuming a diet that's rich in fruits, vegetables, low-fat dairy products, controlling the amount of saturated and total fat, and just having a healthy diet or food regimen is very, very important and very effective. It can decrease your systolic blood pressure by 8 to 14 points, which is pretty significant and sometimes more effective than medications. The added benefit is weight loss. So weight loss is very, very important for cardiovascular health. If you are above the recommended body mass index, a decrease, this was a study that was recently done, a decrease of 10 kilograms can reduce your systolic blood pressure by 5 to 20 points, which is a huge, huge drop. And not only does it drop your blood pressure, but overall it makes you much healthier and reduces your risk for many other diseases. Exercise, it's very important. I know it's not the easiest thing to do, but even minor or moderate in terms of vigorous exercise is important. Whether that be, very high intensity training or even going out on a walk every day, every little bit helps, and it does have markedly effect on your blood pressure. It can reduce your systolic blood pressure by 4 to 9 points. So it's important to keep up. The recommended amount is 3 to 4 sessions per week, lasting on average 40 minutes. So it's important to keep that in mind. I know it can't happen every week, but the more you do it, the better off you are. Reducing your alcohol intake can have a significant impact. That doesn't necessarily mean stopping it, but limiting your consumptions to less than 2 drink equivalents per day in men, or 1 drink equivalent in women, or maybe just having a drink on weekends or something like that. It can have a very significant impact on your health. And the most important, the best thing that you can do yourself to improve your heart health is to quit smoking. If you are a smoker, it's not easy to quit. And it doesn't have to be, cold turkey. It can be a gradual process, but even cutting down by a cigarette a day can have a significant impact on your health. Completely quitting it would be the most ideal thing, and your healthcare professionals, your pharmacists are always there to help. They can recommend resources and recommend any medications that you might need. So if you are ready to quit, it's, speak to a pharmacist, they'd be glad to help. And now I just shortly wanted to talk about herbals or any alternative medications. Many people think that because something is natural, it's harmless, and that's not necessarily true. The way that I think about it is that a natural medication is still a medication. You can still have negative effects from the medication. You can still have an overdose of that medication. So I'm not saying not to take any herbals or any alternative medications, but it is important to always consider that they may be having an effect on you and they may be interacting with your other medications. An example I like to bring up is aspirin was discovered from the bark of a willow tree. So while it's not made from the bark of a willow tree anymore, that's how it's discovered. So it's almost like a natural medication, but as I've previously mentioned, it can increase your chances of irregular bleeding, it can cause stomach upset, and it's important to take properly. One of the main concerns with these herbal medications is that they're not studied as much as the medications that are being dispensed from your pharmacy. So while they may show results, they might not be as accurate as is being said. So it's important to research these medications before you take them and maybe take some of the statistics with a little bit of grain of salt, or get multiple resources or speak to multiple professionals before taking these medications. Many of these medications aren't regulated by the government, so you don't know how much of the active ingredient you're getting. So it's important to seek reputable advice and reputable manufacturers. An important thing that I like to mention is some products, some herbal products, have an NPN, so a natural product number, I think it stands for, and that means that it's been regulated and approved by the government, and that you know exactly how much of that medication you're getting. So look out for those numbers on the vials when you are picking it up from the store. It helps authenticate them. And because you are buying these products over the counter, it's very important to keep track of what medication you're taking and when you're taking it, because a lot of these herbal medications can and will interact with medications that have been prescribed to you by a doctor. They can interact with food, for example. So it's very important to keep track and have these conversations with your healthcare professionals. Many times I've spoken with patients who are tired of their medication regime. They want to stop their medications and change to herbals. While I do appreciate that you are, taking a big role in your own health, which is one of the most important things you can do, it is very important to understand the risks of just stopping a medication and changing to another one. And yeah, just consult your doctors. So that's going to be all for me. I hope you had a good time. I hope you learned a lot. While I can't be here to answer all of your questions, if you do have any, and I hope you do, you can email the Cardiac Rehab Center at the email that you see on screen, and they'd be glad to answer your questions. I'd like to thank you again for taking your time to listening to this presentation, and I wish you the best. Have a great day.